Hi guys, it's Rosie, and recently at Oxford House we've been celebrating National Smile Month, and with the money that we've recently raised for Mercy Ships, we've managed to raise over £1,000 in the last 12 months for charity, which I just think is amazing, and we just wanted to thank you all for your donations. Now, as some of you are aware, we did our 2-minute brush-a-thon at work, which was so much fun. We had the dentist and the hygienist and nurses involved. We all brushed our teeth for 2 minutes and it was just a great time. And we just thought, as a follow-up from there, I would give you a little bit of oral hygiene instructions on how to brush your teeth. And what I keep looking at over here is this amazing box. So what we've got is different types of toothbrushes, different types of interspace or single tufted brushes, different types of interdental cleaning, so what you'd clean in between your teeth, and this little model here. This is the most beautiful model ever, and it's beautiful because it's not perfect. Nobody has perfect teeth. So what it includes is we've got a partially erupted wisdom tooth here, and then we've got a little bifurcation showing here, which just means that the gum has receded so far down you can get in between the two roots. We've got a gap here where a tooth has obviously been extracted. We've got some crowding on the lower anteriors, and then we've got a lower premolar here, which is instanding lingually. So what I'm going to do is I'm going to use this perfectly not perfect model to show you how to brush your teeth, how to get in all the nooks and crannies, and what you should and shouldn't be doing. So what we advise is that you brush with a fluoride toothpaste for 2 minutes at least twice a day, preferably definitely at night time, because that's when your bacteria, that's when your saliva flow is at its lowest and the bacteria is able to move around and cause decaying more. So we just advise that you brush your teeth definitely at night and at least once throughout the day. So then you can, you know, in between, I suppose you could use your fluoride mouthwashes, and sugar-free chewing gum helps because that also increases saliva flow, which can wash away all the debris. Drinking frequent water, all these kind of things just help to good oral hygiene, really. So what I'm going to start with is just a simple how to brush your teeth. So I've got here a manual toothbrush. So a very small head, as you can see. It's not soft bristles, they're just a medium. You don't want too hard, you don't want too soft, just good medium. Or you could use an electric toothbrush. Either way is fine, just so long as you do it properly. So what we advise is that you get your toothbrush and you do circular motions on each tooth, just like this. And you want to do that on all the surfaces. So we've got close to the cheek here, and then next to the tongue here. And then we do on the occlusal surface. Now, we can't stress enough how important it is to brush along your gum margin, because that's the bed where the bacteria is going to sit. It's so important that you brush it all off. You want to get rid of it all on that gum margin. And down here we have 2 salivary glands just underneath our tongue, which will almost help with a build-up, which we don't want. So it's important to get your toothbrush just behind your front teeth here and just make sure that you brush away all the debris there, just like that. There we go. And we'll do that for 2 minutes on each tooth. Make sure that you just get in all the nooks and crannies that you can with your toothbrush. Now, there's different types